Hello, my name is Kristina Jackson. I'm a research associate at OmegaQuant, and today we wanted to do a Facebook Live about 2018 has been an exciting year for omega-3s and pregnancy. And so we wanted to do a recap because a big study came out last week. And I'm also particularly interested in this because I study omega-3s and I'm currently pregnant. So this topic really hits all parts of my life. So last week, I think it was last week, a big meta-analysis, a study of studies came out looking at omega-3s and their effects on kind of all aspects of pregnancy, maternal health, and child health. And they were just looking at all the studies that have been done where during pregnancy, pregnant women were either given an omega-3 supplement or a placebo. And some of the outcomes were preterm birth, early preterm birth, prenatal death, adverse maternal outcomes during birth, admission to NICU, all these kinds of things, but they also went into postpartum depression, and childhood cognitive development, vision, anything that has been studied related to childhood or related to omega-3s and mom and child outcomes. And they found, most interestingly, they found a reduction in preterm birth, risk for preterm birth in women who were on the omega-3 supplements. And this was particularly strong in early preterm birth risk. So preterm birth, that is having a baby before you've reached full term, which is 40 weeks. So the real, the cutoff for preterm birth is 37 weeks. And for early preterm birth, it's before 34 weeks. So having a baby quite a bit early. And we have amazing hospitals and technology now. So preterm infants can get really good care and not have the kind of deficiencies that they might have in the past. But carrying a baby to term is absolutely the safest for mom and baby and cheaper and less stressful than having a preterm child. So reducing preterm birth is a really big deal. And currently we really don't have any markers to show if someone's at risk for preterm birth, especially in their first birth. And there's really not a lot we can do about it because we don't really know when it's going to strike. So seeing that women who were given omega-3 supplements pretty much at any time during their pregnancy, but particularly throughout the last part, were at much lower risk of preterm birth is a big finding. So the actual, let's see if I can find this. Oops. Looking for, okay, can't share my screen right now, but I was going to share a screen of a graph that just basically shows those outcomes. So it was an 11% reduction in preterm birth and a 48% reduction in early preterm birth, or 42%, excuse me. So those are risk reductions. Of course, you can never guarantee that preterm birth is not going to happen, but it's a pretty significant drop. And this was from about 70 studies that they combined to find these outcomes. So it's really strong and consistent. These studies really there's been a lot of work in this field, starting with looking at fish intake in countries with high fish intake and pregnancy outcomes. But in this meta-analysis, it's almost completely supplement studies using mostly DHA-rich fish oils, essentially. So, or DHA-rich supplements and or fish oils. And so there were only a handful of studies that had a dietary recommendation included in their study beyond the supplement. The one thing that they didn't really nail down in the meta-analysis is dosage. And so that's the next big question, we think. How do we answer that question? So right now we have a general recommendation for all pregnant women to take 200 milligrams of DHA a day, and hopefully added on to their diet, you would get to about 300 milligrams. According to, not surprisingly, we are not hitting those targets at all in the US, according to dietary intake data. From NHANES, we see that on average, the DHA intake in the US is about 60 milligrams a day versus 200. And the number of women saying that they supplement during pregnancy was about 9%. So this blanket recommendation really is not hitting as many people as we want. So how do we increase people's awareness and get pregnant women to either eat more fish or take DHA supplements during pregnancy? And this also comes back to blood levels, which is what we mostly like to focus on in Omega Quant. And how do these doses relate to blood levels, and are blood levels potentially a marker of someone who would be more at risk for preterm birth compared to someone that marker could be a specific preterm birth risk marker. So that's the next study that I'm going to talk about that came out earlier this year as well from Denmark, and they looked at the Danish national birth cohort. So basically every baby in Denmark is tracked, and you're able to look at outcomes, as well as they usually have samples stored. So they had plasma samples from moms early on in pregnancy in the first and second trimesters, and they were able to take, they had cases in control, so they had 376 women who had early preterm birth, and then they just matched them with 348 control women who went to term. So then they got to look at those women and get their blood from early on in their pregnancy and see if there were any differences. And they found a really, really strong relationship between the plasma levels of EPA and DHA, the fish oils found in the supplements given in the metas, and risk of early preterm birth. That's the early 34 weeks, before 34 weeks gestation. So their main finding was they found a 10-fold increase in risk in women who had the lowest levels of EPA and DHA in their blood. That's a huge number. Kind of the next step up was there were a 3-fold increase in risk for women in the second quintile. So there was an increasing chance, the higher the blood levels were, the lower the risk of early preterm birth. So that, coupled with the information and the findings from the meta-analysis, is really encouraging, we think. So what we've tried to do is kind of think about what would a blood marker look like? What would a blood level of omega-3s look like in a pregnant population? And strongly based on this paper by Dr. Olsen in Denmark, they found that there's what we call a threshold effect at 2 to 2.5% EPA and DHA in your plasma. So we wanted to take that level and convert it to a red blood cell marker, because we mostly look at red blood cell levels, and the omega-3 index, which is EPA and DHA over the total amount of fatty acids in a red blood cell, is what we study in almost every other context. But here we wanted to focus a little bit more on DHA. And that's because it's been kind of the main, in the meta-analyses, a lot of the studies, about 40% of the studies used pure DHA. So we really think that that's making a biological difference. So if we look at the red blood cell DHA level and how that corresponds to that plasma level, we find it comes out to about a 5% red blood cell DHA. And that we think could be potentially used in practice to measure pregnant women's blood levels and then be able to appropriately dose or at least monitor these women for the risk of preterm and early preterm. So most women at the beginning of their pregnancy get blood taken, and we are able to measure fatty acids in red blood cells easily. So there is already a practice of testing for a lot of things in pregnancy. And this is something that we would actually be able to give people supplements based on this place in their blood levels and make an impact, because almost all these studies that have been done, these women come in and don't supplement until even like the 3rd trimester, and they see effects on preterm birth. So there's something you can do with this number. Our general cutoffs that we're currently thinking about are being below 5% red blood cell DHA would indicate that you would want to supplement with DHA for the rest of the pregnancy. So many of the studies that have, some of the most recent studies have dosed with at least 600 milligrams and found that to be safe and effective for lowering preterm birth risk. And many of the studies, we also see that high-risk pregnancies are, the women are often in a RBC DHA level of about 3%. And so we think if someone is below 3%, maybe they'd want to take a higher dose, like 1,000 milligrams of DHA. And this has been done in high-risk pregnancies before, over in Europe mostly, and some in the US. And they found that that's been safe and effective for reducing preterm birth. And women who are over 5%, they would be encouraged to continue with the 200 milligrams a day and just diet, getting fish into their diet, and being able to feel good about being at that level. From our data, we see that about 70% of women who are of childbearing age are likely under the 5% cutoff. So this could really affect a lot of women, and we would hope motivate them and their doctors or midwives to really look at this as a way to improve diet and personalized diet for these pregnant women to hopefully reduce the risk for preterm birth. So to sum it up, we have studies from both the supplementation world and also from looking at blood levels that show higher amounts of DHA in the diet and blood, lower risk of early preterm birth. And so we think that's important, and we wanted to talk about it. So that's it for today. If you have any questions, just put them on Facebook, and we'll try and get back to you. Thanks.